First, I'll start off with the anatomical position. In the anatomical position, I am standing erect, directly facing the observer. My eyes are facing forward, with my lower limbs parallel and my feet planted to the floor. My upper limbs are at my side, with my palms facing forward. Next, I'll move on to the planes. There are three major planes that we focus on. First, there's the frontal plane, which separates my anterior from my posterior. Or in other words, it separates my front from my back. Movement in this plane looks like this. Next, there's the transverse plane, which separates my superior from my inferior. Or in other words, it's just separating my head from my feet. Movement in the transverse plane looks like this. Lastly, there's the sagittal plane, which divides my body equally into left and right sides, and it involves motion like this. My cephalic region includes both my facial and my cranial. In my facial region, my nasal is medial to my otic, and the frontal lobe of my brain is rostral to my occipital lobe. Next, I'll move down the cervical, which attaches my cephalic to my trunk. In my trunk area, my lumbar is dorsal to my abdominal, and my scapula is posterior to my mammary. My thoracic is superior to my phalanges, and my ribs are ventral to my heart. Within the trunk area, there is the umbilical region. In the umbilical region, my navel is superficial to my small intestine, and my stomach is deep to my skin. Attached to the trunk are both the upper limbs and the lower limbs. Included in the upper limbs is my axillary, which is proximal to my antebrachial. Also included is my carpal, which is distal to my brachial, and my manual, which is lateral to my pelvic. Lastly, there's my lower limbs. Included in the lower limbs is my femoral, which is anterior to my gluteal. There's also my patella, which is anterior to my popliteal, and my calcaneal, which is posterior to my pedal.